Hello, my dear pharmacists. This is Professor Komal. I am from pharmacology. In this video, we discuss the antihypertensive drugs or classification for the antihypertensive drugs, which is included in your Drug Inspector 2025 syllabus. Okay, we'll discuss the mnemonics for the antihypertensive drugs, which comes under the cardiovascular disease. Okay. First, we discuss the what is meant by the hypertension. Hypertension means the high blood pressure or hypertension, which is also known as the silent killer. The hypertension is the elevation of systolic and diastolic blood pressure. And what is the antihypertensive drugs? The antihypertensive drugs means the drugs which is used to treat the blood pressure. The normal blood pressure is 120 by 80 mm of Hg, and in hypertension blood pressure is above 140 by 90 mm of Hg, and the severe blood pressure is 180 by 120 mm of Hg. There are two types of the hypertension. First one is the primary hypertension, which is known as the essential hypertension, and in that the causes are unknown, not specific causes, and this is the most common type of the hypertension. Most of the people suffering from this primary hypertension. And second one is the secondary hypertension. In that the causes are known. It can be occur due to the some problems like kidney, renal, endocrine, thyroid problems. Okay, now we'll see the what is the systolic and diastolic BP. Systolic BP means the maximum pressure recorded during the ventricular systole at the time of the contraction, okay, which is the 120 by mm of Hg is normal. And second one is the diastolic blood pressure, that is the minimum pressure recorded during ventricular diastole, means the at the time of the relaxation, and the diastolic blood pressure is 80 by 80 mm of Hg. Now second is the what is the risk factor for the hypertension? The risk factor is age, then family history, obesity. In obesity, the fat deposition is there, then tobacco smoking, alcohol consumption, stress condition, and diet. Now blood pressure, this is the chart for the blood pressure. The normal blood pressure is the 120, systolic is 120, and diastolic is 80 mm of Hg. Pre-hypertension is 120 to 129, and diastolic is 80. Hypertension stage first is the 130, in between the 130 and 139, and the diastolic is 80 to 89. Hypertension stage second is 140 or above 140, and diastolic is 90 or above 90. And the hypertension crisis, in hypertension crisis the systolic blood pressure is greater than 180 and diastolic is greater than 120. Now we'll see the classification for the antihypertensive drugs. This is the classification for the antihypertensive drugs. Now we'll see the mnemonics for the antihypertensive drugs. There are main class for the antihypertensive drugs are the 9. Total main class of the antihypertensive drugs are the 9. The trick for the main classes is A, B, C, D. The trick for the main class is A, B, C, D. 3 times A, 2 times B, 2 times C, and D. Now we'll see the how it used. Okay, first A for ACE inhibitor. Second A for angiotensin receptor blockers. Third A for alpha adrenergic blockers. Now first B for beta adrenergic blockers. Second B for beta plus alpha adrenergic blockers. Then C for calcium channel blocker. Second C for central sympatholytics, and D for diuretics, and last class is the vasodilators. Okay, the first in AC inhibitors the suffix is pril. For AC inhibitors the suffix is pril. Angiotensin receptor blockers suffix is sartan. Alpha adrenergic blockers suffix is zosine. Beta adrenergic blocker suffix is LOL. Same beta plus alpha suffix is LOL. Calcium channel blockers suffix is depine, and the diuretics for diuretic suffix is IDE or 1. Now we'll see the mnemonics for one by one class. First class is the angiotensin converting enzymes inhibitors, means ACE inhibitors. Okay, ACE inhibitors, the suffix is pril. AC inhibitor suffix is pril, and the trick for the AC inhibitors is cell phone ringing. Cell phone ringing. Okay, how to remember? First, C for captopril, then E for enalapril, L for lisinopril, P for perindopril, F for fosinopril, and ringing for R for ramipril. In second class is the angiotensin receptor blockers, that is ARBS, and the suffix is sartan. The trick is अरब की तेल या ऑयल वाली कैंडी लॉस्ट हो गई. ओके, अरब फॉर अर्बेसार्टन, तेल फॉर टेलमीसार्टन, ऑयल फॉर ऑल्मीसार्टन, वाली फॉर वालसार्टन, कैंडी फॉर candy sartan, and lost for low sartan. Next class is the alpha adrenergic blockers. Alpha adrenergic blockers, the suffix is zosin. The trick is तेरा पैरा डॉग फेनी के साथ फेटा पी रहा है. ओके, तेरा फॉर टेराजोसिन, पैरा फॉर प्राजोसिन, dog for doxycycline, pheny for phenoxybenzamide, feta for phentolamine. Okay, next class is the beta adrenergic blockers. The suffix is LOL, and the trick is for beta and beta plus alpha adrenergic blockers. The trick is similar. Okay, beta पहले मीटिंग अटेंड करो, फिर अल्फ़ा और लैबी के साथ कार ले जाना. द एग्जाम्पल्स आर बीटा फॉर बीटा एड्रेनर्जिक ब्लॉकर्स प्रोप्रानोलॉल, पहले फॉर बेटा फॉर बीटा, पहले फॉर प्रोप्रानोलॉल, मीटिंग फॉर मेटोप्रोलॉल, अटेंड फॉर अटेनोलॉल. देन सेकेंड वन इज अल्फ़ा, बीटा प्लस अल्फ़ा और लैबी फॉर लैबिटेलॉल, और कार फॉर कार्वेडिलॉल. नेक्स्ट क्लास इज द calcium channel blockers. The suffix is depine. Trick is no, help me friend David. Okay, now trick how to apply. No, first no for nifedipine, second no for nicardipine, next no for nitradipine, F friend for F felodipine, and in David initial D for diltiazem, A for amlodipine, V for verapamil, and I for isradipine. Next class is the central sympatholytics. The example is clonidine, and second one is the methyl dopa. And 8 number class is the diuretics. The suffix is IDE or 1. The trick for the all diuretics is हैदर ने कल इंडिया आते ही फिर से अम्मी के साथ स्पाइरल राइड किया. इन डायरेटिक्स देर आर 3 टाइप्स: thiazide diuretics, high selling diuretics, and potassium sparing diuretics. Okay, first thiazide diuretics, हैदर for hydrochlorothiazide, कल for chlorthalidone, India for indapamide. Okay, second class is the high selling, फिर for furosemide, and potassium sparing diuretics मध्ये अम्मी for amylorides and spiral for spironolactone. And last class is the vasodilators. The example is the sodium nitroprusside. Okay, this is the trick for them, and this is the trick for the all antihypertensive drugs. Okay, now we'll see the mechanism of action for the antihypertensive drugs. The first class is the diuretics. For the diuretics, the mechanism of action is mechanism of action is which helps to the remove the or loss the sodium or water loss from our body. Diuretics help to the sodium and water remove, so decrease the blood volume and decrease the blood pressure. The next one is the angiotensin, mechanism of angiotensin. Okay, angiotensin, in angiotensin how to work. The first,